tiny cut could kill you. A broken tooth could become a death sentence. And a simple fever? There were no antibiotics, no hospitals, and no doctors coming to save you, yet. For hundreds of thousands of years, humans somehow survived. They crushed strange plants into wounds, drilled holes into skulls, and used treatments that sound terrifying today. But here's the mystery. Some of them actually worked. So what did ancient humans know about medicine that we've only recently begun to understand? Imagine falling during a hunt 20,000 years ago. Your leg twists beneath you, and you hear a crack. Today, an X-ray can locate the fracture. Doctors can realign the bone, immobilize it, control pain, and operate if needed. Your ancestors had none of that. So was a broken leg a death sentence? Not always. Ancient skeletons contain fractures that healed during life. Bone can rebuild itself when the damaged area stays reasonably stable. Prehistoric people knew nothing about bone cells. Yet experience could teach a simple lesson. Movement hurt, while keeping an injured limb still could help. They may have supported arms or legs with wood, bark, hide, or plant fibers, though such materials rarely survive archaeologically. But here is the problem. No splint could solve. Who fed a hunter who couldn't walk? Care. Someone may have brought food, offered protection, or helped them move. Medicine may have begun not with a drug, but with one human, refusing to abandon another. Then came an enemy far harder to understand: infection. People could see swelling, pus, fever, and death. But bacteria were invisible. Germ theory was unimaginably far away. Different cultures blamed sickness on spirits, curses, ancestors, or other supernatural forces. Observation: try a plant. Watch the result, remember it. Pass the knowledge onward. Studies of Neanderthal remains have found evidence associated with plants including yarrow and chamomile. Dental calculus from one Neanderthal with signs of dental problems also contained evidence associated with poplar. Poplar contains salicylates, chemicals related to the chemistry behind aspirin. That Neanderthal treating pain, but herbs were not the most shocking treatment. Some ancient people opened human skulls. Trepanation involved deliberately making an opening in the skull. Imagine a stone tool approaching your head, with no modern anesthesia, no electric drill, no antibiotics, or sterile operating room. Why would anyone do this? There was probably no single reason. Some cases may have related to head injuries or illness. Ritual and spiritual beliefs may have mattered in others. Some trepanned skulls show healing around the opening. The patient survived. And if that seems unbelievable, a discovery in Borneo goes even further. Inside Liang Tabo Cave, archaeologists found the remains of a person who lived around 31,000 years ago. Part of the lower left leg was missing. Researchers interpreted the evidence as a deliberate amputation, performed years before death. The individual appears to have survived for roughly 6 to 9 years afterward, without a modern surgeon, without an operating theater, without antibiotics. Think about the challenge. Severe bleeding had to be survived. The wound had to heal without a fatal infection. And someone missing part of a leg would have needed extraordinary support. There was another danger: pain itself. Without modern painkillers, even cleaning or setting an injury could be agonizing. Some plants may have offered limited relief, while touch, rest, warmth, and immobilization could reduce suffering. But none of this made prehistoric life safe. A treatment that helped one person might fail another. That uncertainty makes every healed skeleton more remarkable. It is not proof of a secret lost medical system. It is evidence of people experimenting, remembering, adapting, and sometimes succeeding when the odds were brutally against them. For every healed fracture, countless people may have died without leaving an obvious mark on bone. A tooth infection could become deadly. Childbirth could turn catastrophic. A deep cut could become infected. An open fracture could expose tissue to dangerous microbes. There were no vaccines, blood transfusions, IV fluids, CT scans, controlled modern anesthesia, or reliable antibiotics. So why didn't disease and injury wipe humans out? Because their oldest medicine was already inside them. The human body. Blood clots to slow bleeding, skin repairs damage, bones rebuild. The immune system attacks invading organisms. Fever can be part of the body's defense against infection. Modern medicine didn't create these abilities. It learned how to support them and intervene when they fail. One generation noticed which plants seemed useful. Another learned that an injured limb should be protected. People discovered the value of rest, warmth, food, and care. Useful observations could survive because they were remembered and shared. Today, you can break an arm, see the damage on a screen, have it stabilized, and understand exactly what is happening. And perhaps that's the real answer to our mystery. Ancient humans did not possess magical forgotten cures. They weren't stronger than every disease. Nature wasn't a perfect pharmacy, many treatments failed, and many lives were lost. Their bodies fought, their communities cared, their experience became knowledge. So the next time you swallow a painkiller, receive antibiotics, or have a broken bone placed in a cast, remember how long the journey really was. Medicine didn't begin in a laboratory. It began beside fires and inside caves, with wounded bodies, bitter plants, primitive tools, careful observation, and desperate attempts to keep someone alive. And another chose to help. And everything we have today grew from the same question our ancestors were trying to answer thousands of years ago. How do we keep this person alive? And if you want to uncover more forgotten truths about how ancient humans really lived, survived, and changed our world, subscribe to First Fire, because the past is far stranger than we were taught.